This is Dr. Henry Hurwitz at the University of Maryland School of Dentistry. Today we're going to be demonstrating the block carving technique for fabricating an acrylic temporary bridge. In addition to that, we will be reviewing some basic rules of occlusion, which you will see on your screen now. They are: number one, the buccal-occlusal line angle of the mandibular teeth rests in the central fossa line of the maxillary teeth. 2. The lingual occlusal line angle of the maxillary teeth rests in the central fossa line of the mandibular teeth. And Rule 3, cusp tips rest in marginal ridge areas except the mesiolingual cusp of the maxillary molars and the distobuccal cusp of the mandibular molars, which rest in the central fossa of their opposing molars. On the screen, you see the equipment we will use for this exercise: some Vaseline, Parkel Snap ethyl methacrylate acrylic, which we'll be using. In addition, we'll use a red pencil for marking, an instrument for mixing the acrylic, a paintbrush for spreading Vaseline on the surfaces, an old-fashioned glass dappen dish, our dentiform model with prepared teeth on the upper from 12 through 14, an acrylic burr, another diamond instrument, a rubber wheel, and a separating wheel, which is a diamond multi-sided wheel. I like to use an ethyl methacrylate such as Snap for this type of bridge because it has a lower exotherm temperature during curing. Also, there seems to be less polymerization shrinkage compared with jet. Here we have our maxillary model showing our prepared teeth on the upper, number 12 and 14, and aponic for 13. You can see we have enough occlusal clearance for the thickness of the acrylic, and when we make this temporary, we will be guiding it with a canine guidance and trying to pick up some group function at the same time. We're going to lubricate the opposing arch with some Vaseline so the acrylic doesn't stick when we close and go into an excursion. Now we'll lubricate the model of the prepared teeth and the adjacent areas. Next, we'll be mixing our acrylic, the Snap liquid and powder in a dappen dish. We'll add our liquid to the dappen dish and then add our powder gradually till we get the proper consistency. When the acrylic reaches a doughy-like consistency after perhaps 1 to 2 minutes, we can then remove it from the dappen dish and place it on the articulator. Our acrylic is now ready, and we've lubricated our fingers with some Vaseline to prevent it from sticking as we mold the acrylic into an oblong kind of shape. And we're going to place that over the 3 teeth. Now we're going to close the articulator canine to canine and slide into maximum intercuspation. This will give us the inner inclines of the maxillary buccal cusp, and if we do it right, we will get some guidance on some teeth besides the canine. While the acrylic is still in the doughy stage, we don't want to remove it, but once it gets into kind of a rubbery stage like you see here, we can remove it and then replace it. This helps ensure that you won't get locked into any undercut areas on the adjacent teeth. So we'll close it again, we'll wait a little while longer, and then remove it again. Now it's getting a little harder, still a little bit rubbery. Close it down again to maintain our occlusal height. And here is our finished block of acrylic. This is the intaglio surface. At this point, we're going to mark some of our landmarks. It may be hard to see because it's hard to write on this acrylic at this point. We're marking the palatal occlusal line angle and the central fossa of the maxillary teeth, as well as an estimate for the buccal occlusal line angle, which is really an estimate at this time. We're also going to mark the contact areas with the adjacent teeth. These are areas as we're carving down our bridge we do not want to violate because it will leave us with an open contact. The block is now ready to begin carving, and we'll be doing that with an acrylic burr. We're going to go over the interproximal areas, maintaining that red area where the contact was, but trying to create proper contours, especially at the gingival area. Now we're going to start removing some of the excess acrylic on the underside and the lateral side down to within a millimeter or so of the actual margins of the preparation. We'll do that on the buccal and the palatal side. Now we're going to remark our landmarks. Going to remark our central fossa line and the palatal occlusal or lingual occlusal line angle. On the inside, we're also going to mark the margins of our restorations, much as one would do when ditching dies. This will help us avoid hitting these areas as we're carving down our acrylic. We're going to continue on the buccal and palatal sides, reducing the buccolingual width of the teeth down to closer to an approximation of where they belong. We're still doing this from the underside. When doing this carving, it is important to bring back the anatomy lessons you learned in school in your first and second years to understand the morphology of the teeth, the buccal heights of contour, the palatal heights of contour, the emergence profiles, the proximal embrasure contours. All these things come into play as you carve this tooth back to its proper dimensions within the framework of the bite we did on the articulator. It's a good idea at this point to replace the carving back on the articulator. Close the articulator, check and make sure the adjacent teeth are still in contact so we know we haven't changed the bite any. You can see we've accomplished that here. Now I want to point out something on the intaglio surface of the premolar. We have a bit of a pull that occurred because the acrylic did not adapt to this surface right here. You can see this. So an easy way to fix this is to just reline that one area, which we're going to do with some acrylic. Mix up a little bit of acrylic. A little bit too dry there. We need a little more liquid. We'll place that into the intaglio of the premolar. We also want to make sure we're still lubricated on there. If it hasn't worn off, we want to replace some of that Vaseline. Now we'll close it down on the articulator. See some of it exuding on the inner side. We need to leave that on there until the rubbery stage, and then we can remove it, check it. A little out of focus here, but there we go. And then put it back on until the final set. We're going to continue carving our proximals and also our buccal and lingual surfaces. Again, keeping in mind that the occlusal markings we made have to be paid attention to. On the palatal side, the marking we placed on the palatal occlusal line angle and approximately 1 millimeter beyond that to the gingiva, toward the gingival. We will try and maintain that and not violate that. We're just going to continue carving here, and we'll jump ahead a little bit so as not to bore you too much. We're continuing our carving here, going slowly as to make sure we avoid damaging the margins and also avoid compromising the occlusal contacts on the supporting cusp and the guiding cusps. Here's a picture of it now in place in the mouth. And we're going to change instrumentation here and put on our diamond wheel. Doesn't have to be a diamond wheel, but I happen to like it because it's flexible and is good for doing the embrasures. You can use any kind of cutting disc for this. Now we're going to go to the underside and begin to separate the three teeth by creating the interproximals, the embrasure areas, starting on the bottom because we have a good landmark there. By angling the instrument mesial and distally, you can create good embrasure contours for the papilla. Now we're carrying these separation lines over to the buccal and palatal to help delineate the three teeth better. And also onto the occlusal surface. Just a slight separation of the teeth for a landmark identification. Now switching to a diamond instrument, which isn't quite as aggressive in cutting as the acrylic burr, for refining the contours a little better. At this point, we're going to replace it on the dentiform and remark our landmarks, our central fossa line here. And also our lingual occlusal line angle and the functional outer aspect of that, as well as we're going to mark here the approximation of the buccal cusp tips, which is equidistant from the central fossa as the palatal occlusal line angle, thereby composing the occlusal table. Here you can see we've replaced it on an articulator, used some blue articulating paper, and gone into a working guidance, and you can see we picked up guidance on the premolars, both premolars, and just a little bit on the molar. It's not always possible on an articulator to get these very accurate because the articulator does not move in a smooth fashion. Now we're going to refine the embrasures a little more. Use the wheel to give good contour to the embrasures. Giving a little contour to the pontic. I'm now switching to a straight crosscut Fisher burr, which I like for defining the anatomy a little better, grooves and fissures, and creating a better looking anatomy on the teeth. I want to be careful at this point not to be touching areas you shouldn't be touching, such as the centric holding cusps. We've now completed most of our carving and remarked with some articulating paper in our maximal intercuspal position. You can see we have pretty good contact on the palatal cusp and some of the interproximal central fossa of the maxillary molar. Here we've marked the lateral excursions. You can see the canine, the first premolar, and the second premolar, not so much on the molar. When we close it into articulation, you can watch as we slide how they separate in guidance. The second premolar disc articulates first, then the first premolar, and then the canine. Here we've removed our blue markings, finished some final contouring and polishing of our restoration, although not a final polish, and marked our landmarks with red paper, and you could see how nicely they mark and how our centric cusps, the palatal cusps, are nicely marked, and our lateral excursions are also nicely marked. This concludes our block carving exercise.